Welcome everyone to our Female Leaders in Successful Women Leaders in Public Health event. I am so excited about this. I'm so excited that we are celebrating Women's History Month by highlighting some of our amazing leaders in the public health space. I firmly believe personally that women run the world. And so I had a blast planning this and really just kind of deciding what we want to highlight, what's important right now in this time and space in history. So first things first, I want to thank and acknowledge the people who made this happen. So Aparna was another School of Public Health Alumni Network board member. My name is Alyssa Tadero Brooks. I'm the president of the School of Public Health Network. This was a collaborative event with the School of Public Health and the Alumni Network. So I also want to acknowledge and thank Jennifer Schwartz and Gretchen Neal. And soon you'll hear from Dushanka Kleinman. So we're very grateful for their support and coordination. This is part of a series of events that the Alumni Association is putting on as part of Women's History Month. So we are excited to be having this conversation today. I am going to turn it over to our fearless moderator, Dushanka Kleinman, who is the Associate Dean for Research and the Principal Associate Dean of the School of Public Health. And she will be giving you an overview and introducing, turning it over to our panelists to introduce themselves. So thanks again for joining.
Oh, Dr. Brooks, thank you so much for organizing it, for leading the Alumni Network. We're just so delighted to be here and be able to sort of learn from one another and all the wonderful participants that have joined us as well about the challenges and triumphs of women leaders in public health. So I'm looking forward to it. We're each going to give a little bit of a short introduction of each of ourselves and how we define leadership. I'll start and then I'll turn it over to Dr. Roberts, then to Ms. Basin, and then to Ms. Kessler. So as I said, I'm delighted to be able to moderate this event. I'm a professor and principal associate dean for the School of Public Health. I came into public health as a clinician, a dentist, and then entered public health after a residency in hospital dentistry and a master's in residency in dental public health, which is a specialty of dentistry. I've been with the school since 2007 and had a wonderful time during its developmental phase. And I had spent most of my career as commissioned corps officer, retired as rear admiral in the public health service, and most of that time at NIH. So to me, leadership is a sport activity. I see it as one where we work together to identify a clear team vision and to support progress towards a goal. So I'm turning this over to Dr. Roberts, the baton.
Thank you, Dr. Kleinman. Welcome, everyone. It's so great to be here. My name is Jennifer Roberts. I am an associate professor in the Department of Kinesiology here at the School of Public Health. I've been here since fall of 2015. And I look at a lot of things in life, but mostly I look at the relationship between our environments, whether they're built natural or social environments, and the relationship between our movements and our physical activity movements, recreational, our active transportation, our movements of just play or for purpose. And so I'm very happy to be here today. I think for me, I define leadership as bringing others around you and supporting others, uplifting others, amplifying their strengths. I also think leadership means trusting and respecting those who you work with and being able to have confidence in their abilities. And then finally, I think leadership means having to make those hard decisions and or calling out injustices when you see them. Thank you.
Thank you, Ms. Basin.
Hi, everybody. It's a pleasure to be with the staff and students from the University of Maryland and this distinguished panel. I graduated from the University of Maryland in the undergraduate business school in 1971. Obviously, before many of you guys were born. That's kind of a scary thought, but it is what it is. I mention that only because I was really only one of maybe 3 or 4 females in the entire business school at the time. And among the 20,000 undergraduates that we had at the school, there were really very few non-white people in our population. So things have progressed and changed, and all for the good, I hope. I went to the university at a pretty interesting and turbulent time during the Vietnam War. So you can imagine what the campus life was like at that time. So after working for an accounting firm, that was my major in the business school, for a couple of years, I went to work in management consulting for a firm that was led by a physician. And this firm specialized in public health, and that's where I got my introduction to the public health system. And we focused on program development and applied research kinds of contracts, primarily with the federal government and some with state governments and local community programs as well. So there I brought my financial skills because I didn't have a health background at that time. And I worked with local public health kinds of community programs like primary care and maternal and child health and family planning clinics. And then for many years, the substance abuse programs were the major part of the work that I did. I also returned to school and got a master's in clinical psychology at the University of at Antioch College, which was located at the time in Columbia, Maryland. So after rising in management in consulting firms, I started my own firm in 1985 with a female colleague. And we grew that firm to about 300 staff and many more consultants until we sold it in 2018 to Blue Cross of South Carolina. So over the years, I filled many different roles. I say that as a female-dominated organization, we did everything. We typed, we wrote, we produced, we built business, everything over the years. But I mainly served as the co-CEO and chief financial officer. I also led a couple of acquisitions of small firms, and I was very involved in some of the larger organizations that represented our industry. And along the way, I raised 2 daughters who are developing their own careers and raising their families. And I retired about 1.5 years ago. So I'm embarking on a new phase of my life centered around enjoying hobbies and playing with my young grandchildren. So as to the question of leadership, I kind of think about the growth of a company and the growth of its people. So I'm a little different than probably the other panel members because I really was a businesswoman. So I was always hyper-focused on growing the company, which meant increasing its revenues and profits. And I was always looking at data and taking what I consider to be reasonable risks to try to achieve that end. And lucky for me, the work that we did was so interesting and rewarding that everyone wanted to share in growing the business. At the same time, I considered a major role for me and for other leaders in helping to grow the careers of our staff. And I really enjoyed mentoring a lot of staff over the years and encouraging them to try out their new ideas and take risks. And I often sort of approved something that someone wanted to do that I kind of knew wasn't going to work, but I thought it was good to learn and the world wasn't going to fall apart. So that was one of the strategies I used in kind of mentoring people. So I'm glad to be here.
It's wonderful to hear of your background. Thank you so much. And we'll move on to Ms. Kessler.
Hi, everybody. Thank you so much for having me. I'm honored to be with such a wonderful panel and excited to see actually familiar names in the participants, people that I had the opportunity to work with when they were students, and now we're here in this setting together as professionals and colleagues, so that's really exciting. My name is Kelly Kessler, and I currently am the Bureau Director for Population Health and the Director of the Howard County Local Health Improvement Coalition. I work for the Maryland Department of Health through the Howard County Health Department. I've worn a number of professional hats, and I think that my background and my completing my undergraduate degree at the University of Maryland back in 1997, before we were officially a school of public health, we were College of Health and Human Performance. I had the opportunity to start out my career in public education. So I actually was a teacher in the Prince George's County public school system, and was had the opportunity to start my career actually teaching special education, even though I was a health educator by degree. What was very interesting to this day, there is no audience that I have ever come across that is scarier and possibly smellier than 8th graders in the month of May. No matter how many letters, degrees, ranks, professionally people may have. I think that that foundation in education and reaching people where they are has been very critical. Professionally, I've also had the opportunity to lead and facilitate a number of coalitions and groups, both through nonprofit settings as well as academic and governmental settings, and had the good fortune of returning to University of Maryland College Park as an employee twice, once working in coordinating tobacco programs through the University Health Center, and then again later on actually supervising that position as well as others in that role as the Assistant Director for Health Promotion at the University Health Center. And then later on had the opportunity to meet my colleague Jennifer Schwartz in my role working with the Office of Development and External Relations through the Division of Student Affairs. So always happy to come back and continue giving back. And I think that aligns very much with my philosophy around leadership. To me, what I have learned over the years is leadership is really putting intention to action. And sometimes that is through mentoring other people who are developing. Sometimes it is through taking things that I have found personally relevant. I am a 22-year cancer survivor. I am the proud wife of a service disabled veteran. Taking my intent and wanting to help or wanting to serve in those roles, and actually finding ways to put those things into action, either through volunteerism or service or through professional opportunities. So very happy to be here and look forward to the discussion today.
Thank you so much. I just love it. We have a bouquet of panelists that have such different career paths and experiences. And I think we're going to learn from, already are learning from them about how they look and view leadership. We're going to ask some questions that we have that cover, the waterfront, from leadership styles all the way to some fun questions at the end. We'll try as well to, if you have questions from the audience, to add those on as well. But we'll start with a leadership issue. And this one is a little bit unusual. The question is, more often than men, women tend to feel the imposter syndrome, that they're really not supposed to be where they are in leadership. And so the question, and I'll start with Dr. Roberts, have you experienced this? And if so, how have you navigated through it?
Yes, I have experienced this. I still experience this today. You have that, that voice inside of you that makes you think, oh, I don't know if I know everything that I'm supposed to know, or you feel, you're not qualified. And I remember when I was in grad school, right before I was defending my dissertation, my advisor, she actually said, just remember, you know more about this topic than everyone else in here. And that helped me in that time period. But then there's other times where you're like, well, I know there's other people who know a lot about this topic too. And I think for me, what's helped me kind of work through this imposter syndrome feeling is that it's okay if you don't know everything about everything, and it's okay. And I think people actually find it refreshing when you say, oh, you know what, that's a really great question, but this is outside my wheelhouse. Or sometimes I'll say outside my sandbox. I just like the idea of playing in a sandbox. But anyhow, I'll admit it, and I'll say, I don't know. But I also usually say, I'm so happy that I can learn about it. Can you tell me? Or can another panelist tell me? And I think it kind of just helps yes. And it disarms everyone, not thinking, oh God, I don't know every answer. So that's usually what helps me, is knowing that I don't have to know everything, you know, and I look at my work and my scholarship as not a destination orientation, but more like a journey to, I hope I will continue to learn and learn and learn until my last breath on this earth. So that's kind of how I deal with it.
Well, thank you so much. I mean, I really like that fact about opening it up and being honest and direct. So Gail or Kelly?
So I was just thinking about actually how you were talking about it, and I was reminded kind of a little bit different twist on how I might have experienced it. When I got into the workforce, I was pretty comfortable with my quantitative skills and with my ability to do that type of work. But I really was very insecure and not very skilled in my written verbal skills. And so I struggled just horribly in my first several years. And as it turned out in consulting, I had to have a lot of good written skills. So I just worked and had many anxiety attacks and learned from other people. And eventually one day I woke up and said, oh, you can actually write. At least you can do business writing well. But what I noticed is that men don't do that. Men, at least in my experience in the workforce, they only worked in areas where they already knew they were good at. They always found a way to avoid all the things they weren't good at. And so I was always trying to teach people, you're going to have to learn the things you're actually not suited for as part of kind of a broader collection of skills that you need in the workforce. And at least that's how I approached it.
I would say from my experience, it actually is very recent, and sort of putting yourself in a role of things you're not really maybe out of your comfort zone or out of the sandbox, or, you know, that you don't necessarily have experience in this last 2 years. I think many of us in the public health sphere, we had certain things that we feel very confident in or comfortable in. And many of us have found us in a place of responding to a global pandemic, and, you know, being in that position. I know I have definitely struggled a little bit with the imposter syndrome when, you know, here I am leading a significant portion of, you know, an incident management team in a huge, you know, global pandemic emergency response. That's a little intimidating, right? And definitely not something, you know, I can practice, and I can take my FEMA trainings, and I can do exercise and table, you know, mock-ups, but that has definitely been something that has, I think, good or bad, because many of us were sort of in that situation. We've had a lot of support from each other in the sense that we were sort of, as our health officer here in Howard County often says, we were building the plane while we were flying it. And so that really, you know, kind of having that grace to say, okay, I don't actually know this yet, but I'm going to, and falling back and relying on the fact that you do have foundational training and you have a network of folks around me. So, you know, learning to be resourceful is actually something that I have found has helped me significantly when I start to feel that place of imposter syndrome set in, of like, why am I here? Why am I at this table? I don't really belong here. Or sometimes I don't want to be here, but I have to be. All of those things really kind of being able to point back to, okay, I have the training for this. I have the resources to know if I don't know, someone who does know, and really relying on skills to connect with other people, I think is incredibly critical.
Well, you know, we all have been in a community of imposters the last 2 years. So I think that really sort of resets us. But I do love this issue of making sure that you are making progress, opening yourself up to new challenges, letting yourself actually embrace the imposter syndrome and say, I can do this, I can learn, I can apply it and go forward as well. So my next question I'm going to ask Gail to respond to is, would you say you exercise balance in your life? You just said you have recently been retired, so you have a lifetime career.
That's a good question for me.
and what does, during your life, as in your many careers that you've had, what did you see as work-life balance? What did it mean to you?
So I don't think I had work-life balance for many, many years. I would say I was kind of a failure at that, but it was by choice. Right. So I worked really hard over the years, certainly until my business was matured. But I also spent a lot of time with my children. And so my only two priorities till I was probably in my 40s was work and children. And I was perfectly happy with that. I enjoyed both parts of that life. And I didn't really have much time for exercise or activities, except for the small kind of, I did like to travel. So our family traveled on big trips once a year, and we really enjoyed that. But I wouldn't say it was a work-life balance. So when my children became teenagers and the business matured, then I began to start saying, okay, well, what are you going to do with this extra time? Now you have some time for yourself. So then I did begin doing more things that were for just me. So interestingly, I retired. And so now I have all the time in the world for me. So that's a really unique experience. I had to kind of see, how do you like this? So far the year and a half, I'm enjoying it, and I have 2 new grandbabies, so that gives me plenty to do. And so we'll have to see what the next life balance is.
There's always a balance,
There's always a balance.
Right? So Jennifer, Kelly, any additional thoughts on the balance challenge?
I think the one thing I would just add about the balance is I've had to learn how to say no and not be afraid of like missing out or losing out. Like, oh God, that's so cool. I want to do that. Oh, I want to do that. I want to do that. And just be like, you know what? I can't do everything. And so just being able to say no has probably helped me balance things a little bit better. But this balancing everything has always been a struggle for me, even ever since I was a kid. But I think as I've become into more middle adult years, it's a little bit easier when I can just be like, no, you don't have the bandwidth. No, you don't have any more time. Just no. So learning how to say no.
And I would add for myself, it's sort of redefining what balance actually means. And sort of, I think that there's always this like misperception of, 50-50 is balance, right? Because you think about that, and I hear people talk about that in relationships and stuff, but in some cases, the balance, it's okay for it to be 30-70, or it's okay for it to be 40-60. And sometimes when I'm balanced, it's okay for me to say, okay, I need to be 90% work focused right now. And I need to have arranged the supports in my life so that I can make sure that 10% is totally covered, or vice versa. Because when I need to be 100%, I'm always 100%, 150% mom, right? And so when I need to be able to focus on that, I need to be able to do that. And so just redefining my own acceptance of what balance means. And that's not always one size fits all, or, the same. It's not static.
Well, I'm reflecting as you're speaking on the percentage. What does balance mean? I really appreciate that comment, and I reflect on feeding the children and making sure they get their vegetables and fruit in addition to other things. And I sort of organized it so that in a week's time of meals, they would get a certain proportion of vegetables and fruit. It may not be at each meal.
We did a lot of quality control lunch packing in our
Right,
house, where everything was balanced out and I could see who was taking what in their bags.
That's right. So I'm going to, this next question, Kelly, I'm going to go back to you to start us off. As a leader, how do you stay mindful of who's at the table and who's missing from the table? You've had to do that in your job many times in your coalition building.
I think my answer to this has probably evolved over the years. And I think that learning to come to my own growth as being along a continuum has been a real sort of pivotal thing for me. where I am in my answer today is probably a very different space than I would have been 15 years ago, 10 years ago, 5 years ago, 2 years ago. For me now, one of the things that I do to make sure that I'm mindful of who's at the table and who's missing is intentionally try to find myself in situations where I am at tables that I have not been at before, or that I may find growth opportunities for myself, or may be hearing from folks very different from myself. An example being, in public health, we've talked a lot about, underserved populations and vulnerable communities, and, lots of language that I don't always agree with in terms of how we're, labeling. But it was very apparent to me that we had significant gaps in connecting with African-American residents in Howard County in the work that I was doing, and really trying to be proactive and making sure people were being vaccinated and had questions answered. And for me, one of the things that I did was intentionally become a member and join our health committee for our local chapter, because that was something sort of outside of my comfort zone. I knew that I had personal knowledge that was a gap. Like I didn't know, I couldn't understand, because it wasn't a lens that necessarily I don't have lived experience. And although I am, quote unquote, a well-intentioned individual, in order for me to become an action-oriented individual, I really need to have a better understanding. And so for me, part of making sure that the voices are included at the table is making sure that I never forget what it feels like to not necessarily be at a table, or to be uncomfortable at a table, or to be in a space where I need to learn or, participate. I am a member of our Veterans Commission here in Howard County. I'm a family representative, and that's an interesting table to sit at when, number one, I'm at a Veterans Commission table as a non-veteran. I am also a woman, and I'm representing an interesting connection to the veterans and military families in our community. And so often being able to even examine how I feel when my contribution is responded to in a certain way, being mindful of like the reactions other people have, or oversight of something, or discounting of something that I might think is important to contribute. I think being mindful of it from that personal perspective helps you remember how it feels, so that you are better able to bring other people in. I think also just admitting when you don't necessarily know, and honoring the fact that, like, I don't know a lot of things. And so I want to learn from others, and asking that question and inviting people, but not inviting people in a way that, and I think this is incredibly important for coalition building, where you're using people. I think that's just, the word dirty comes to mind. Like, it doesn't feel good. Nobody wants to be invited to a table so that somebody can say they were there, or to be invited to a table because, you're, filling an important seat. I don't just want you to invite me to the table. I want you to ask me what dishes are important to me to bring to the meal, and how can I help prepare the meal, and how can I be a part of that whole event, not just, I want you to be at the table to be at the table so I can say you were at the table. And I think that that's incredibly important, and something that I've tried to be really mindful of. And as I said, it's been a growth process. It's been very much for me, and the lens of the world that I've experienced in my own professional development, very much I can say I've grown from making sure people were invited to the table because I knew that they needed to be invited to the table, to really truly appreciating that I'm not just asking them to my table, I'm asking them to be a co-host with me. I'm asking them to build the meal with me. So.
No, thank you, Kelly. I'm going to turn it over to Jennifer and Gail, but I just wanted to say that sometimes we have our blind spots. And sometimes, even though we want to be mindful, we may not know how to be mindful. And so I'm curious as to there's some ways that could help us. We may need support in that effort.
So I'll just give a real short story. I was attending a meeting with the government. So there were a number of government officials there, and a number of people representing myself. And I had just read Sheryl Sandberg's book about leaning in. and she talks about being at the table. And so I was sitting there and I noticed that around the table, outside of the table, was my government project officer, who was a woman. So why wasn't she sitting at the table? There was no space specifically, right? So I don't know, I would have noticed it, but I don't know if I would have said something had I not just finished reading that book. So I turned to her in the meeting and I said, so-and-so, why don't you come and bring a chair and sit with us? And I got this big smile, thank you. And I thought, I wonder if I would have noticed that before. I would have noticed it, but I don't know that I would have said something. So that was a learning for me.
That's a protocol issue in federal government, which is really interesting. A good point. Jennifer, your thoughts about the table?
Well, I really agree with what has already been said. I really like Kelly's analogy of making a meal. I might steal that and use it another time. But I think for me, I feel like I've always been conscientious of this because I've always been numerically the minority at a table, whether it was because of my skin color, my gender, or what have you. So, or both. And so I like to look at a table and see who at this table doesn't look like me. And that's kind of one of the things, or who at this table doesn't have shared experiences with me, who has different experiences. And that's how I continuously stay mindful. But I think it's something that's just intrinsic in me, that it's not necessarily something to be mindful about. Like I'm consciously always assaulting the lack of inclusiveness, lack of diversity in whatever I'm doing. So I think it's just ingrained in me. So I don't have any other things to say other than it's just a part of who I am.
Well, I think that's a very important point that you've raised, because for some people, it's a learned experience. It requires practice and training. And having it been ingrained in you, you're able to mentor others and be able to help us as we go through these experiences. I always feel that we do things so quickly, we're accelerating, moving fast, and we just do it whatever's the easiest way. And it takes time to be mindful. So thanks for your comments. And Jennifer, I'm going to stay with you now for the next question. What advice do you have for women entering a male-dominated field? Any experiences that you personally have had?
I think my only advice would be really continuously reminding yourself what you bring to the quote table that the men cannot or may not be able to. And when you're able to do that, you'll always recognize that you are an integral part to being in that field, and how your talents and your unique experiences as someone identifying as a woman will be able to enrich the field. Just overall, I've been in situations where I've been the only woman. I'll actually tell one little funny story. So the summer before I was going into 7th grade, I went to a private school, right? And this is a private Catholic school, and the school was thinking about closing the high school portion, and they didn't know if they were going to close the middle school portion. It's a lot of back and forth. But and a lot of the students in my 6th grade class, their parents were like, oh, let me just go and put the kids in other schools. My mom was just staying steadfast. She's like, oh, Mount St. Joe's, it's not going to close. So that summer, actually not even the summer, like probably like the 2nd week of August, Sister B, I'll never forget, she was the principal. She called my mom. She said, so we're not going to close, but unfortunately, there's only going to be 8 students in the 7th grade class because so many have left. And also, Jenna's going to be the only girl. So my 7th and my 8th grade, I was the only girl. And I could say those are some of the best years. I learned who said something about a smelly 8th grade boy? Was this on this podcast, this
Kelly.
Zoom?
Yes, I'm telling you, 8th graders in May, they're a special animal.
Well, I learned a different appreciation too. I was able to really understand them from just being this minority in that room of the only girl. And it was actually a blast. I mean, it was experience. And then I flipped it. And then when I started high school, I went to all girls school. But I think just having these constant visions of being numerically the only one for many modalities in terms of, actually, I was the only Black person in that class too, along with being the only girl. It's just, you just see things differently. And so I think it's just one of those things that when you are in a male dominated situation, you can see some benefits to it because you're able to see things differently, but also remind yourself you belong there just as much as they do.
I love that learning experience early on in your life. I mean, that's like perfect. Who would have organized that? So Gail and Kelly, your thoughts? I figured Gail,
I started out in the workforce when there was mostly men, and especially in my field. And I have many horror stories, which I won't bore you with, of being told we can't hire you because you're a woman. But I worked well with most men over the years. Some had the sort of fear reward kind of style that I didn't really ascribe to very well, so I just ignored it. I remember my interview with my first consulting firm, and he said, "What are your goals, or where are you going?" And I'd said, "I don't know, I'm 23 or 4 years old. I haven't gotten there yet. I'll think about that." And after the interview, he said to the person who wanted to hire me, I don't know how to motivate her. Like, how would you motivate her? She doesn't seem to respond to the kinds of things I said." And he said, "She's self-motivated. I don't need to motivate her." So he had a better understanding, I think, of women. As a result, I did better with him early on because he got it, and most of the men didn't.
Well, thank you.
I don't know what else to add to that?
Kelly, any additional thoughts?
It's actually, professionally, I will say that most of the spaces that I have found myself in have actually been very female dominated. And so, in my career, teaching in public school, in a lot of the nonprofits that I've worked with, interestingly, I've actually even had the good fortune of, most of those were fully led, with the highest level being female leadership as well. I've had definitely interesting experiences from the personal level of the volunteer roles that I take. And I think, my current work with the Veterans Commission here in Howard County, it is very, it is predominantly male. And so that is a very interesting experience. And I do find myself sometimes even having kind of a visceral reaction to, when to insert myself, when not to insert myself. And so I'm sort of exploring that with myself. And what does that mean? I will say, to me, my lens has always been women large and in charge. So it's it's different. I guess that's a good lens, but.
Well, thank you. And sort of shifting on to another topic area, but relevant to this discussion is, and Kelly, I'm going to stay with you, is what has been the most significant barrier in your career, and how did you overcome it? And then sort of the flip side of what has been an achievement that reflects your overcoming the barrier?
Honestly, I think in some respects, my biggest barrier has been myself, in the sense that, I think some people go into their careers with a very clear picture of this is where I want to get. I jokingly say my professional path has been more like Winnie the Pooh in a honey pot. I kind of find myself walking along and I'm like, oh, this is fun. And I slurp up the honey. And then I'm like, okay, I kind of want to try another honey pot. So let me walk over here and I'll try this one. And not to say that it's, I've been very fortunate, but there have definitely been times when I found myself in a honey pot per se that was definitely not where I felt like I fit. And so I think a barrier for myself has really just been in, I would say it's a barrier and an opportunity that has really afforded me an opportunity to try a lot of different things, very different things, everything from, grant writing to classroom teaching to fundraising to, any number of things. And sometimes when I talk about the experiences I've had, people are like, it's sort of random. I think that it's something, there are a couple questions in the chat and comments in the chat about, people who are interested in, how do you sort of explore public health and those different opportunities. And I don't necessarily encourage the Winnie the Pooh and the honey pot approach to professional growth and development, but I do think that challenging yourself and not being afraid to try different things and different content areas is really important, and always kind of keeping in mind transferable skills. Some of the things that I learned in my time working completely out of public health and in development, where I was really doing, straight fundraising and scholarship facilitation. Those are some of the best lessons I learned. At one point, I totally stepped away and I did real estate for a while and learned about, communications and marketing in a for-profit land. So just not being afraid to put yourself out there and try something different. I think half of finding your path is finding the paths that aren't your calling and sort of exploring and finding the things you like and the things that you don't like. That is actually part of what I would say when, the question of what am I most proud of? I think in terms of a professional accomplishment, something that I could say that I am most proud of is actually tied back to the University of Maryland College Park, in totally outside of the public health space. In the work that I was doing, I had the opportunity to be part of the original grant funding that allowed us to be recognized as a veteran student success center. And so being a part of working with, Dr. Gunther Stevens and that whole team, and really actually leading to the development of a veteran center and putting some formality to that, truly is something that I am most proud of when I talk about all the things that I've done. And that wouldn't have happened if public health hadn't led me to the space of learning about writing grants and learning about building relationships. And, it really does. It's one of my favorite children's books is called All Because a Little Bug Went Ka-Choo. And the whole idea is how one little thing can lead to so many more. And I think that would be, an advice I would give people, is just not to be afraid to try something that is totally outside of that realm, because it may lead to one of the things you're most proud of having done in your life.
Well, Kelly, I think you answered one of the questions that is in the chat about advice to someone changing careers and having no background. In this case, in the question was in public health and getting into the field. So additions to that question or any advice and experiences, Gail and Jennifer, related to barriers and what you're most proud of and how to help others who are thinking of changing into new areas?
I would say probably my biggest barrier was when I was in grad school. I got sick and I was subsequently diagnosed with multiple sclerosis. And it was a big roadblock because, well, I couldn't see for a while. I mean, that was the most, but it was just other things where you had to question like your health, not only right here and right now, but like, oh, what is going to happen in 5 years, 10 years, 20 years? And so I think I eventually, not immediately, but eventually took that barrier and made it into something that I integrated into not only who I was as a person. I didn't want it to define me, but integrating like other aspects of how I could find therapy in dealing with this disease. So some was walking, some was going outside, physical activity. And then all of a sudden that became a scholarship of interest. So then the other thing, going back to switching careers, I was in consultant too, as well as Gail, for 2 different environmental and engineering consulting firms for about 6 years. And I was doing completely different work that I do now. I was doing toxicology, risk assessment, environmental assessment. And so as I was still learning and understanding and managing my MS disease management, I started to become disenchanted with consulting and become more curious about being able to be a researcher and a scholar of my experience of living a more active life, living a life outside. So I switched careers too. I stopped consulting and I said, I want to be a professor. And that was kind of a challenge because in some fields of the academy, they're drawn to more linear career trajectories. Linear meaning you go to school for a gazillion years, you do a postdoc for another half a gazillion, and then you become a professor. I kind of deviated and I didn't do that classic kind of trajectory. But in any case, I said, this is what I want to do, and I'll just have to figure it out. And so I figured it out and got to a place where I really like now being at UMD and this scholarship and this work. So that barrier of, this health barrier, I mean, it is still a health issue, but it became a part of a scholarship or a passion, I think, that drove the scholarship of what I do today. So were we supposed to ask about the best milestone to date? Was that another part of the question?
Yes, that was your, what you are most proud of an achievement. It sounds like you already have identified that, but go ahead.
I think that probably is that one. And then I'd probably say number 2 is getting tenure. That was a big, it seems so opaque of an achievement. Like it's almost like telling someone you can reach for the stars, but you physically like, how am I going to get up there? But then when you start making little inchworm steps, you find like, I got there. So I guess I could say that's probably number 2 in terms of the most proud milestone.
Thank you, Gail. Add on.
So I'll just be brief to just add a couple of things. So obviously starting a brand new company is a challenge, and there are lots of barriers to growing a company. And most companies that develop don't fail. So I was very happy that, we obviously succeeded over the years, and I had a wonderful partner and we brought different skills to it, but together we were really able to succeed. And in terms of our accomplishment, at one point we won an award, our company, from the industry as the so-called best company under, I think it was 75 million in revenues. And that was a big achievement for us and for the industry, because it was, I think, the beginning of their recognition of companies that worked in the soft science, as opposed to the sort of IT kind of defense oriented businesses.
Well, those are the things that are really important to hold up and celebrate and give as case studies. Since your business background, we're starting to do the case studies in public health as a learning tool, and it's really important to have those out there for others to be able to follow similar paths and get encouraged. I think I really love the discussion that we have. We have a very rich discussion going on concurrently in the chat, so I thank all our participants as well, but we're sort of approaching the closing 10 minutes of our panel, and time really moves very, very quickly when you're having such a lively discussion. So I want to start with you, Gail. I'm going to sort of amalgamate several questions at a time. If you could identify, and we'll go around the table, so to speak, what has been one of your best and most worthwhile investments that you've ever made in your career, and then also advice you would have for someone that is just starting out in the field of public health. You sort of found public health later on. So
yeah, I'm not sure to answer investment, if you will. We were always investing in our company anyway, because our view was to succeed in sort of this public health consulting business. We had to be able to offer a full range of talent and infrastructure. And that in our view, which is not the view of a lot of other companies, so I'm not saying it's the only view, but in our view, if we were only good at one niche thing, we wouldn't be able to solve our clients' problems because their problems were always broader than that. So we were always investing in new talent and new infrastructure so that we could sort of try to get ahead of the curve in terms of the kind of work that was being called for. So that was, in my view, that was the approach that we took. A lot of companies prefer to be just very niche, strong, best in the world in one particular area, but we were more of a general management consulting company.
And advice to someone starting off in public health when you?
So I think the advice is not specific to public health, but to any career. And that is that I believe that taking risks, reasonable risks, is really important and being willing to fail. And I failed many times over the years. But I felt like if you weren't willing to fail, you're not willing to succeed either. And so that's what I told myself over the years. And some of them were kind of painful failures. But they also, I think, led to the success that we had.
Thank you. Thank you very much, Gail. Kelly and Jennifer.
So investment, I don't know. I think my kids are financially smarter than me. So I would say one of the biggest investments for us and for me in terms of, it's really that ongoing training, whether it's, sometimes it's easy to kind of put off the conferences or put off like the extra training. I'm one of the first sort of early on CHES certifications, that sort of that ongoing credentialing. I think that when you have an opportunity to attend something, even if it seems like it's outside of, things you need, somebody offers you a free Excel training, like, okay, take it. Like, I think the best investment is sort of, in that continued knowledge and growth in that. As far as advice for people starting out, I guess, we've all talked about sort of like taking, informed risks, not being afraid to try something new and dip your toes in, and even relying on sort of the transferable skills or knowledge and foundation that you have. But I guess if you come down to that crossroad and you're really like, okay, do I do this or not? Something I have found for myself in how I invest my time and my energy is that question of, is this something I have the opportunity for a redo on? And, sometimes taking that stab at doing a presentation and it like totally falls flat, or writing that grant proposal and you don't get funded, or submitting for, putting your name in the hat for a promotion or a new position and you don't get hired. You can always get redos on those things. You can always try again, but something like how I'm investing in a colleague who's in my office and maybe upset or crying, or, how I'm investing in my own children or in my own health. Like Jennifer had the experience during my graduate degree of, going through chemotherapy, and like, how I invest that. If it's not something I can get a redo on, that's really where, when I'm at a crossroads, I know which fork I'm going to take based on that. And I guess maybe that would be a piece of advice is, fear is just part of this, and we're all going to be afraid of different things. But when it comes down to it, you may always have another chance on certain things, and some things you don't.
Thank you. Jennifer?
I think I would say, when I think of naturally when you think of the word investment, you think about something financial. But I would say for me, the best investment that I've made, I think, is just time in developing who I want to be, like taking like the time to just kind of be very introspective and developing who I want to be as a scholar, who I want to be recognized either in beyond my scholarship, who I want to be recognized. Like one of those things that like, a line that may be read in your obituary. I don't mean to sound very morbid, but something they're like, oh, she was a cool chick, Like, I would like that, as opposed to, oh yeah, she wrote this paper, but I don't really know much about her. So kind of investing in like who I want to be on this earth. So I guess the time, investing time in thinking about that. And the next part of the question, I don't really know the answer to. I was still thinking about it for weeks on end, and I don't think I have an answer to that question. Maybe it'll come by next Women's Month, but I just don't have an answer to that next part of the question.
Well, I will take, Jennifer, I'll take your answer as meaning that the areas of accomplishments and what you're proud of are equally distributed, that there isn't a peak and that there's still more to come.
Yeah.
And I really just love this conversation that we've had. Our chat has been as rich as our hearing panel, and we are going to try to make sure that we have that available for everyone as well. But some of the things that have come up from our conversation is Gail started us off with saying, take reasonable risks, and some of your very first comments, Gail. The chat has talked about how critical mentors are. Kelly has shared Maya Angelou's poem, A Day Away, that she has on her door, which is really lovely. The issue of managing your energy versus your time was a chat comment that I thought was really important shift. And the differential definition of work-life balance and how it changes over time. And I want to end not only with thanking the panelists and thanking the Alumni Network for organizing this, but also, Jennifer, I'm going to take your comment of the time needed in developing who I want to be as a motto that we put up for our conversation today, because each of you have done that. You may not have articulated in that way, and you're still doing it. You've done such incredible things, and you'll continue to do that no matter what stage of your career you're in. So I really appreciate your time and thank you. And I don't know if I turn this over to Dr. Brooks or how we come to a conclusion.
Yes.
Yes, Dr.
I'm
Brooks.
happy.
Thank you
So am
much.
I frozen by chance?
We're there. We hear
Okay.
you.
Anyways, thank you all so much. I learned a ton. I learned a lot about women leadership, and I also learned that we need to make this an annual event, because I think this conversation could go on for much longer and in a lot of different formats. So thank you all for sharing your insights. And to just bring it full circle. So one quick plug, if you're interested in helping us coordinate events like this, please consider applying for board membership on the School of Public Health Alumni Network. We are currently accepting applications, and the link is in the chat. I'm happy to personally chat with you if you have questions or you're interested. And to bring it full circle, I would like to say that I hope you all, as women leaders, continue bringing your unique meals to the table, with or without vegetables, to kind of create this really bountiful public health feast that's just dominated by women in leadership. And I'm so inspired by this discussion. So thank you all again for being here. And we really, really appreciate the panelists and the coordinators' time. Have a great rest of your Wednesday, everyone.
Thank you for organizing.
Thank you.
Thank you.